There are some hidden costs that you need to know before signing up for Medicare. Hey, I'm Randall Garcia and I'm with Medicare Pro, and I'm happy to share with you today some things that maybe Medicare didn't tell you, or maybe they did. Maybe it's in that big book, that Medicare and You book that they expect you to read from cover to cover. And maybe there's a few lines in there that maybe you need help understanding or getting clarification on. So I like to say what they don't tell you. Here's what I've been told by clients over the past 12 and a half years. They say, well, I didn't know that. Nobody told me. And so I'm going to cover 3 of those things. Maybe I'll give you a bonus one at the end of what people feel like they didn't know before. And so I'm going to start with number 1. Number 1, people believe that they were never told about late enrollment penalties. Late enrollment penalties are such a huge thing to understand. It's kind of scary going into a program that is very confusing, that many people don't know a whole lot about. Maybe you're transitioning off of an employer coverage, and maybe you're retiring out of that plan. And now instead of having a benefits administrator from your workplace, now you're on your own. Or maybe you did marketplace plans and you called the health insurance marketplace, and maybe you're transitioning off of that plan because you're getting Medicare. Or maybe you're a federal employee, or you're in teacher's retirement and you're kind of confused on your plan options, and you just want to make the right decision so that you can avoid all penalties involved. Well, I've got good news for you. The big thing that you need is you need an insurance broker. You need a Medicare professional to help you along the way so that you can avoid the penalties. But why do people get penalized? Let me hit on that for just a minute. Why do people get penalized when it comes to Medicare? Well, the biggest reason why people get penalized is because they do nothing. You see, the biggest thing that you can do is to be proactive. Most of the people that I've encountered that have kind of gotten this maybe snowball of penalties over the course of months or years, it's because they decided to do nothing. They didn't contact a Medicare expert. They didn't call Social Security. They didn't enroll in Medicare. And so they just decided, you know what, I'm going to do nothing and I'm going to hope that it all works out. And so the big thing that I want to tell you is that there are several different penalties that you need to be aware of. And at Medicare Pro, we can tell you what those penalties are and if you'll even be subject to them. But the big thing is, don't do nothing. Do something. The 2 main types of penalties are called Part B, as in boy, penalties. That is for not enrolling into Part B, your medical part of Medicare, on time. And the second biggest penalty that we come across is called the Part D, as in dog, Part D prescription drug, Part D enrollment penalty, where you don't select a drug plan in time and Medicare starts penalizing you for every month that you didn't have Part D coverage. These penalties can be scary. Another one, this is kind of a bonus. We don't really consider it a penalty, but most people do consider it, is the income related monthly adjustment amount. We call that Medicare IRMA. And so the higher your income, the more Medicare or Social Security is going to bump up your Medicare premium. So these are the things that they don't tell you, or maybe it's hidden in that big book that we talked about. So the big thing you need to understand, number 1, is penalties. The second thing that people come to us and they say, nobody told me about all this. It's the out-of-pocket costs on certain plans. You see, certain plans either might have a high annual out-of-pocket maximum, and so it would leave you subject to high medical costs. Other plans have high deductibles, maybe deductibles that you were not prepared to pay. Other plans, maybe they don't cover your prescription drug costs, and so now you're kind of left open to paying a lot of those expenses on your own since your plan doesn't cover it. So out-of-pocket cost is a huge deal. And they can actually affect you in many, many different areas outside of the ones that I just mentioned. For example, if your doctor is not in network with the plan that you chose, guess who's paying the out-of-pocket costs for seeing a doctor that's not a part of the plan's network? Well, you are. You're going to either pay the full cost or you're going to pay a larger portion of the cost depending on the type of plan that you enrolled in. So it's important to understand what your costs are on the plan that you choose. The third thing that people feel like they were never told when it comes to their Medicare is the prescription drug out-of-pocket max or limits. Many people don't realize that certain drugs will fall on certain tiers depending on the prescription that's prescribed to them. So generic prescriptions, you might get away with paying $0 for those, but if you're taking a brand name drug, people don't realize that there may be very high deductibles when it comes to filling that brand name drug, or people may not realize that they may have to pay up to their $2,000 out-of-pocket max in their Part D prescription drug program. So drug coverage gaps, or maybe the lack of drug coverage for your specific prescriptions, is a huge deal. And so all of these things are what we get calls about, and clients will say, they never told me. Nobody told me it would be like this. Nobody told me that there would be penalties, and nobody told me that there would be so many out-of-pocket costs and high drug costs and deductibles. And so the big thing that we want you to understand is meeting with a Medicare professional, it's going to be to your advantage. Our services are offered at no cost and no obligation. So if you want a free Medicare consultation, go to our website at www.medicarepro.online, and we'd love to connect with you and help you in your search for the right Medicare plan. And a bonus here is that we're going to tell you the whole truth and nothing but the truth. We're going to make sure that you know the ins and outs of the plan that you choose. We're going to make sure that there's no gaps and that you understand all of the costs that are associated with the plan that you choose. So I hope this information was helpful, and we hope to hear from you soon.